Ling, Jiao, Tang, commonly translated as antelope horn and uncarrier decoction, is a classical traditional Chinese medicine formula in the category cool liver and extinguish wind. Its core action is to cool the liver, extinguishes wind, clears heat, and calms spasms. The pattern framework is extreme heat generating internal wind. This mini-lecture focuses on the formula logic, recognizable pattern features, and practical drug-herb interaction screening. It is an educational overview, not an instruction to self-prescribe. Start with the pattern rather than the disease label. The traditional target pattern is extreme heat generating internal wind. Typical clues include high fever, tremor or convulsion, irritability, headache, red tongue, wiry rapid pulse. These findings are not all required, and the same biomedical diagnosis can present with different Chinese medicine patterns. Conversely, these traditional signs can arise from multiple biomedical conditions. That is why pattern differentiation and conventional red flag screening should occur together. Key herbs commonly associated with this formula include Ling Yang Jiao substitute, where appropriate, Teng, Sang Yi, Yu Hua, Sheng Dai Huang, Bai Shao, Chuan Bei Mu, Zhu Ru, Fu Shen, Gan Kao. In classical formula analysis, some herbs address the principal mechanism, others support the chief action, and others harmonize or direct the prescription. The exact composition can vary by lineage, manufacturer, granule concentration, and modification. For interaction analysis, the actual ingredient label and dose are more important than relying only on the traditional formula name. The first interaction focuses Gankao and electrolyte-sensitive drugs. Licorice-containing formulas deserve attention during sustained or high-dose use. Glycyrrhizin can produce a mineralocorticoid-like effect in susceptible people, with sodium retention, blood pressure elevation, and potassium loss. That can matter with loop or thiazide diuretics, digoxin, corticosteroids, antiarrhythmics, and existing hypertension. The risk is dose, duration, and patient-dependent. In practice, ask what prescription drugs, over-the-counter products, supplements, alcohol, caffeine, and other herbal formulas the person uses. A multi-herb product can create several overlapping mechanisms at once, so medication reconciliation is a core safety step. The second interaction focuses pharmacokinetic uncertainty and medication review. For many multi-herb formulas, high-quality human interaction data are limited. Laboratory findings on cytochrome P450 enzymes or transporters do not always translate directly into a clinical effect. The correct response to uncertainty is not to assume zero interaction, it is to review the complete medication list, use reputable products, avoid unnecessary polypharmacy, and monitor clinical endpoints that matter. The quality of evidence for herb-drug interactions ranges from pharmacology and case reports to controlled human data, and that evidence is uneven. Therefore, distinguish a proven contraindication from a plausible additive effect, and use monitoring where the uncertainty is clinically meaningful. Safety summary. Seizure, high fever, altered consciousness, or acute neurologic symptoms are emergencies requiring immediate medical care. Also verify species identity, processing method, contamination testing, and manufacturer quality. Stop and seek appropriate care for severe or rapidly worsening symptoms, allergic reactions, fainting, chest pain, major bleeding, neurologic deficits, or other red flags. Pregnancy, breastfeeding, significant kidney or liver disease, and polypharmacy warrant a lower threshold for professional review. A useful clinical checklist has 5 steps. 1. Confirm the traditional pattern. 2. Identify the exact product and full ingredient list. 3. Reconcile prescriptions, over-the-counter drugs, supplements, and other herbs. 4. Identify measurable endpoints, such as blood pressure, glucose, inner, electrolytes, symptoms, or malfunction when relevant. 5. Reassess after starting, stopping, or changing the formula rather than assuming the response will be stable. In summary, Ling Jiao Tang is best understood as a pattern-based prescription, whose action is to cool the liver, extinguishes wind, clears heat, and calms spasms. The key safety principle is targeted interaction screening plus objective monitoring when risk is plausible. Standard references for further study include Chinese herbal medicine formulas and strategies by Bensky and colleagues, Chinese medical herbology and pharmacology by Chen and Chen, and current drug interaction and pharmacology references.